Hi everyone, happy Wednesday. Today we're going to be discussing health tech accessibility and how to create more accessible environments in the tech space and on websites and in healthcare. And we'll actually have a special guest joining us today as well. Just going to wait for my fellow folks to get into the room and then we'll get started. Hope everyone's having a gorgeous week. The weather's looking up down here in the DMV, so that's very exciting. We had a pretty gloomy couple of days. Welcome everyone. Just waiting to get Whitman-Walker in the room and then we'll get started. Great. So, during the COVID-19 pandemic, Whitman-Walker's Community Health Department has expanded its outreach efforts to the social media platform. We cover various topics about HIV and STIs and sexual health practices and access to care, as well as social determinants of health and public health interventions. The community health team is here to educate and support you. Looks like we've got Whitman-Walker in the room. Yay, same here, Sage. Thanks so much for joining. Any moment now. In the meantime, while you're here, if you haven't already, check out the comment that will be pinned shortly. If you are in the DC, Maryland, and Virginia area, you can access HIV and STI testing with Whitman-Walker Health. Just give us a call at 202-797-4439 to schedule an appointment, and we will help you get tested. Hello, Whitman-Walker. Thanks for joining. So cool. My name is Jewel, and I use she, hers pronouns. And I work to bring educational Instagram lives to this space with Whitman-Walker's Community Health Department. Today, we're going to discuss Global Accessibility Awareness Day and health tech accessibility. According to accessibility.org, digital accessibility is the belief and practice that every user deserves a first-rate digital experience on the web. So someone with a disability must be able to experience web-based services, content, and other digital products with the same successful outcome as those without disabilities. This awareness and commitment to inclusion of the goal is the goal of the Global Accessibility Awareness Day, or GAAD for short, or GAD. This is a global event that shines a light on digital access and inclusion for people with disabilities. So next week, Thursday, May 19th, actually marks the 11th annual Global Accessibility Awareness Day. So it's a fairly new but definitely aging holiday and awareness and recognition day. So here's a little bit of data on accessibility. In 2020, WebAIM analyzed 1 million homepages for accessibility issues. The WebAIM Million Report identifies the following causes for the most common accessibility failures, as seen on homepages. So people have 86.3% of homepages out of this million had low contrast text. 66% had a missing image alt text, so this is like what you'd see if you were to hover over an image and had a text pop up to you. A lot of them didn't have that. 59.9% had empty links. 53.8% had missing form input labels. 28.7% had empty buttons, and 28% had missing document language. That's just a little bit of data around this day in awareness. And without any further ado, I'd love to bring on our guest. So in recognition of Global Accessibility Awareness Day, we have a special guest joining us on Instagram Live. Their name is Kai Wong, and they are a health tech accessibility advocate and a recipient of the 2021 DC Femtech Award in the category of code. So please help us welcome Kai onto the Instagram stage. Welcome, Kai. Hello.
Hi, how's it going?
It's going good. How's your Wednesday so far?
Awesome, just got a lot better.
Yay.
Good to see you.
Good to see you as well. And hello, everyone in the chat. Gerald, good to see you. Can you please introduce yourself further to the audience here today? We know that you're a health tech accessibility advocate, but tell us a little bit more about yourself.
Yeah, so I am an accessibility manager at Healthtech Health, basically the virtual health platform, redefining healthcare to be more on the online world and reducing barriers. So really excited to be accessibility is all that I my complete focus and my passion as well.
Awesome. Sorry. So you were cutting out just a little bit. I don't know if the microphone might be like sitting on something, but just heads up that we heard you, but it was a bit choppy at times. So just let's see if we can hear you a little bit better now. But thank you so much for joining us today. Super excited to have you here and sharing your expertise and knowledge in this space.
Awesome.
So what makes you passionate about health tech accessibility?
You know, I think like my answer to that, what makes me passionate about accessibility, it's just like I know what it feels like to be excluded from things, and it's not cool. I mean, I grew up being bullied, and I know what it feels like to be on the other side of nobody thought of you in their plans. So I always channel that to think of like we have to include people with disabilities in everything we do, even from the planning phase, designing phase, things like that, because it does not feel good to be on the other side. Also, in healthcare specifically, making sure that everything is accessible to people with disabilities is particularly important because of the consequences, right? The health outcomes that we influence by creating those barriers, but more importantly, by making sure those barriers are not in our technology. So, important work.
Thank you for sharing that. Yeah, I think many of us had our bullies growing up, and so great to hear that you're channeling that energy into positive impact and work in your field. What are some of the ways and tools that you personally and professionally at your company you all work to make healthcare technology more accessible?
So we're doing a little bit of everything. I mean, I really hit the ground running, and right now we're working on building up an accessibility team as well at Teladoc. So there's going to be a lot more to come, but right now we're really busy with embedding it throughout the software development lifecycle. So from product planning all the way through down to design, of course, then to quality and development. And yeah, just going through that cycle, making sure that we have stop gaps in everywhere we go, milestones, and making sure that everyone knows what they're doing. You know, training is a huge thing. Advocacy is as important as it is the technical skills it takes to implement accessibility.
Yes, thank you. That's super important, and glad to hear that the team is being built and on the rise and ready to do some amazing work in that space.
Thank you.
What are some of the basic features for identifying if a health tech tool is accessible?
Sure. Yeah. So that one is really good. That's a good question. It's all about using the right tools to measure accessibility. So there's things like automated tools that when you're on the web browser, you can literally just go in your dev tools and it's built into Chrome. So you just hit F12 on your keyboard and then you go over to Lighthouse, which is a piece of the dev tools, and it's basically an accessibility scanner. So you just scan it, hit that the generate button, and then out comes a grade out of 100. And it'll also identify about 30% of the accessibility issues that are on the page. And then aside from automated tools, there's also manual testing that you have to do. So it's a combination of manual, automated testing, and of course, like user research, including people with disabilities and those assistive technologies being used in their everyday lives, and user research and testing.
Thank you. I hope everyone was paying attention. I will definitely be checking out that dev tools option later on today. That's super exciting to hear about. I know that Whitman-Walker actually recently implemented this tool called Recite Me, and I think a few people in the DMV, like care system area, or DC, Maryland, Virginia care system area, have actually implemented this tool on their website. So it basically will zoom in for you if you want to. It'll read the page in different languages to you. You get to select your language, but there's just different accessibility tools built into that, kind of plug into people's websites. So people are working at it slowly and surely. What's the most important tip or piece of knowledge that you want folks to leave here with today regarding health tech and accessibility?
So the number one thing I always tell people is no more images without alt text. I mean, that's just a big no-no. You know, I left that one in 2020, and every year since I have to renew it and tell people this is my New Year's resolution and it should be yours too, because it's totally just a bad habit, and we all need to do our part in adding alternative text to images that's on social media, in PowerPoints. And then, you know, of course, I want to mention that that's important for people who are using screen readers. So, you know, if somebody is blind and they're using a screen reader, which basically just announces what's on your computer out loud, and otherwise, so say, for example, you're navigating the web with your screen reader going, you're having a great day, and then you hit an image without alt text, your screen reader might just announce the file name, which is completely annoying and inappropriate at times, right? Because it'll be like fall 2013 selfie mode in the mirror, and it's like .jpeg. Nobody wants to hear that. It's more about like being descriptive of what the meaning is behind the image, so that way people who are blind or using a screen reader have the similar experience as others. And lastly, that you don't have to be an expert in accessibility to do that, or even just to ask the question. I always say, you know, at your next party, just lay it on them. Ask them, say, yo, what are you doing to make your project accessible? And, you know, all it takes is just a question, and that gets the conversation rolling, and that's how you make a difference.
Thank you so much for those tips. Actually, I think I skipped one question a bit earlier, and I'm super excited about this one. What is your dream catch-all update for improving healthcare tech tools? Like, if you could just snap your fingers and have this update applied to every health tech app and website and system, what would it be?
Ooh, that's a good one. That's a good one. I like that question a lot. Yeah. Ooh, okay. So if I could snap my fingers, I think I really have to think hard on this one, because of course my first answer would be like snap my fingers and everything is just fixed, right? Then I might not have a job. No, I'll always have a job, right? There's always improvements to be made and innovations to be had. So that's only a joke. But I think if I really could snap my fingers and make one thing change, it would be that, you know, reducing barriers even more. So virtual healthcare is already a great way to reduce the barrier of transportation, especially important for people with mobility issues or limitations, right? So that's an awesome thing that I get to work for a company that already got rid of that barrier. But there's other barriers, right? I would just love to see all of healthcare to be online. Like, there are always going to be things though that you do need to go in. Like, for example, you know, you got to get a biopsy. We're probably not going to be doing that in our kitchen anytime soon. But I would really love to see technology go that way, where everything that someone needs to get done for their own healthcare wellness can be done just through their own phone in whatever capacity it is, and in the privacy of their own homes, and just you and the screen, you know? It's so important to make everything digital.
It still boggles my mind how quickly, you know, as a whole in society, we adopted telehealth and teledoc and just digital healthcare spaces and apps once COVID-19 started. Like, you have to wonder if we would still be like, no, you've got to come in person had we not experienced this pandemic together. But thankfully thankfully in ways we were pushed to accept more accessible ways for folks to engage with their healthcare. But of course, it's been a long pandemic, and we've lost so many people, and we hope to not lose any more. So on that note, I'm going to give some COVID-19 information for folks after this, but wanted to thank you so much for joining us, Kai, and really appreciate you sharing so much knowledge and tips and tricks in this space for helping people be more accessible and healthcare advocates in that way. Any final words for our guests and viewers tonight? But you froze. We'll see if you come back. We actually have a question that I think is probably for Kai. Oh, let's see if that works. The question is, do you find that digital natives practice accessibility more naturally than older generations? So I'm going to screenshot that and save that for later and follow up with our person who asked that question. But thank you all so much for learning about Global Accessibility Awareness Day. Again, that is next Thursday, May 19th, and also for learning about health tech accessibility. Before we go, we want to give you some reminders about COVID-19 and the vaccines. So if you've already gotten vaccinated, congratulations. You've taken a really important step to preventing yourself and your loved ones from becoming sick with COVID-19. Many variants have continued to sort across the US, so it's super understandable if you still want to wear your mask. The COVID-19 vaccine isn't 100% effective at preventing new cases of preventing new cases of COVID-19, but does help prevent people from getting super sick with COVID, from hospitalization with COVID, and from death related to COVID. That said, please stay alert and follow the CDC guidelines on best practices for keeping COVID out of your life. If you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has COVID-19 vaccine available. Everyone ages 5 and up is eligible to get a COVID-19 vaccine. Please call us at 202-207-2480. to schedule an appointment with Whitman-Walker. And if you're having trouble making an appointment with us, DC residents can visit vaccinate.dc.gov or call 1-855-363-0333. Maryland residents can visit covidlink.maryland.gov or call 1-855-634-6829. And Virginia residents can visit vaccinate.virginia.gov or call 1-877-829-4682. If you haven't been vaccinated and you're not looking for an appointment, please continue to follow CDC guidelines for mask wearing, quarantining, social distancing, and the like. It's very important that you consider getting the vaccine and discuss COVID precautionary measures with those who are around you. But of course, be mindful of masks and keep your distance, but especially when you do not know if the person that you're around has been vaccinated or not. Please remember to follow us on Instagram, Facebook, and Twitter at Whitman-Walker, and check our website at www.whitman-walker.org for the most up-to-date information on our services. And for more information on COVID-19 resources and general Whitman-Walker services, you can call us at 202-797-4439. That same number can be used to schedule an HIV or STI testing appointment with us, but also for any questions on our resources or local resources that might be of help to you. Please follow our Whitman-Walker programs at RealTalkDC_ and at NoFilterDC. And thank you so much, Kai, for joining us again this evening. We learned so much from you. Thank you for sharing the space. Have a good rest of your night, everyone. Happy Wednesday.